welcome to our special show, Know Your Heart. September 29th is observed as World Heart Day, an initiative to create awareness about different conditions that can affect your heart. Heart attack, cardiac arrest and other cardiovascular diseases have remained a major health concern. But over the years, a rising number of cardiovascular problems among the younger population are being diagnosed and reported. In fact, cardiovascular diseases are the leading cause of death globally. According to the global burden of disease, nearly a quarter, which is 24.8% of all deaths in India, is due to cardiovascular diseases. And now studies even suggest that many COVID-19 survivors may experience some type of heart damage, even if they haven't really had an underlying heart disease. Joining us on the show today, Dr. Professor Ashok Seth, Chairman, Fortis Escorts Heart Institute, Luke Coutinho, Holistic Lifestyle Coach and Founder, YouCare, Ira Trivedi, author and founder, Yog Life, Tapan Singhel, CEO, Bajaj Allianz General Insurance, and Sunil Khurana, CEO and MD of BPL Medical Technologies Limited. Thank you all so much for joining us today. Starting with you, Dr. Seth, in post-COVID world, do you see that the risk of heart diseases have increased? And if yes, how?
So you're absolutely right. In multiple ways, the risk of heart disease has increased. We've said a lot about COVID and heart disease and how COVID affects heart disease. So that's one aspect. And we all have realized that COVID itself can cause heart disease. It's affected numerous young individuals because COVID works on three ways on the heart. Even with minor COVID illnesses, one can actually get affection of the heart, and that's based on three factors. Firstly, COVID itself causes inflammation of the heart arteries. It causes thickening of the blood, and that leads to clotting of the blood inside the arteries of the heart. You've probably heard of the very fact that young people have developed heart attacks because of COVID. They've had their blockages progressing very rapidly, as well as clotting of the arteries to the brain, leading to strokes. So this has been one of the vicious presentations of COVID in young individuals, creating heart attack. But the other phenomena is also increasingly worrying, and we're seeing more of that in our times, that patients present with weakening of the heart muscle. COVID causes inflammation of the heart muscle. Heart is a muscular pump. It pumps blood to the rest of the heart, rest of the body, and weakening of the heart muscle results in gradually deterioration of the heart function. People come in with shock, people come in with end-stage heart failure, and we're seeing enough of that. Many individuals who don't even know they've had COVID actually come up with weakening of the heart muscle and heart failure, and we realize only after blood tests and antibody testing that they actually had COVID, which was silent. Also during COVID times, heart disease increased in multiple ways because people, unfortunately, during lockdown, or in a fear from going to the hospital, neglected themselves, neglected their drugs, neglected exercise, were psychologically also under pressure. There was increasing stress, and we see suddenly that when they come back, they come up with more advanced disease. They've actually left their medication, they come in with heart attacks, and certainly now we see all of them coming back with increasing disease processes. So COVID has transformed the world into a more severe and perhaps more delayed heart problems that we had ever seen before.
Actually, like you said, people have been neglecting their health. Luke, if I come to you here, COVID is one aspect, but we're also seeing a lot of healthy people, they go to the gym, they have a very healthy lifestyle, sleep on time. Why are fit people really dying of heart attacks?
So I think, like Dr. just explained, the heart is a muscle that pumps blood to every single one of the trillion cells. Mm-hmm. Today, the younger generation and the current generation is either overtraining or undertraining. They're overtraining without rest and recovery. It's a well-established medical fact that sleep deprivation is a massive risk for heart failure, heart disease, and the right word the doctor touched upon was inflammation. A lot of young, fit people have uncontrolled inflammation in their bodies today. Second, all these fad diets that exist where people are pumping themselves with supplements, performance-enhancing drugs which are easily available, all of this is too much for the heart to handle. And their heart rates go up to 120, 140, even 200 during a weight training session. And over and above that, they want to maintain their normal social life of sleeping late, socializing. So there is overtraining and there is under-recovery and rest. even if people are training the right way and eating the right way, I think a massive risk factor in our country is sleep deprivation. And we all know with sleep deprivation, inflammation at every level of the heart, the brain, the kidneys, all the vital organs increase. That's why we sleep, to manage inflammation better. So it's a combination of very poor lifestyle. And I think the world has to change the perception that fit people cannot get heart attacks. Because we can only see the external appearance of fit people, but we don't know the underlying causes of. A lot of them are going through depression, emotional stress, high cortisol, high adrenaline because of the stress. They also have hidden factors in their life where they're smoking a lot and undersleeping. So I think we shouldn't measure health anymore by looking at the physical appearance of someone, but we have to have an overall holistic, assessment of that individual.
Okay, so Ira, like Luke just told us, it's our lifestyle, okay, whether it's sleep, eating right. Yoga is something, which is really good. And post-COVID, we've even seen that a lot of people have started doing yoga. What are your thoughts on that?
Namaste to everyone on this panel. Thank you. It's so lovely hearing everyone speak on their own perspective. I want to bring attention to one very important thing here, which is the breath. And this is combining some of what Doctor had said, some of what Luke had said. And this is also the reason why yoga is so, so helpful with COVID recovery and in general. See, the diaphragm is like our second heart. The diaphragm is a very important muscle actually, which is right here. And this is helping our lungs and our heart pump blood when we breathe. The problem is that so many of us don't even breathe correctly. Just the breath is not correct. We're all doing such shallow breathing from our throats, breathing from our clavicles. We're not even engaging the diaphragm. So when you don't breathe correctly, there is a lot of pressure on the heart because the heart has to do double the amount of work when the work could have been split up between the diaphragm and the heart. So the importance of the diaphragm, especially in this post-COVID era, is extremely important. And that is why yoga has become so important. Because if you do not breathe correctly, you are putting undue strain on your heart every single moment. This is my personal belief why you suddenly hear about young people dying of heart attacks in their offices, without any reason. It's accumulation of so many different things, and the breath is a very important factor which we don't look at deep enough. And that is why pranayam, breath work, all of it is so important. Another factor is stress. Stress, major problem. And again, yoga is working on relieving stress on a physical level and on a mental level. The yoga asanas that we do, they're working on your body in such a way that they're physically removing the knots of stress in the body, the energy knots in the body, because ultimately, from a yogic perspective, all disease is trapped energy. We believe that, watching TV or watching Netflix or scrolling on WhatsApp is stress relief. It's not really. We need to work a little bit harder to achieve that actual sense of stress relief, which is going to ultimately relieve pressure from the heart and our emotional states.
Mr. Singhel, COVID treatment has proved to be backbreaking. It has taught us a lot. So also being more prepared financially for any eventuality. How important do you think it is in today's world to get a health insurance?
It's always very important. See, one thing which is very, very critical is that if you look at it, if you have a good health insurance, you are able to get treatment from the best doctor, from the best hospital at a very early stage. So it's a question of life and death, as I always say. So from that perspective, it is very critical. Second, if you look at the COVID time, people who had a good cover, they could get admitted, they could try and get a good bed, and they could get good treatment. If you don't have a good cover, you try and avoid hospitalization as fast as long as possible, and then it may get too late. And the second wave, we also saw the shortage of beds also. It caused huge difficulty. So I think a good health cover, which does not cost much, gives a huge mental peace. I think it's very critical to have it. Be it COVID time, be it normal times, but I think a good health cover is very, very critical to have.
Mr. Khurana, sometimes there are gaps in diagnosis and treatment. How important is monitoring your vitals? Especially like if somebody has high blood pressure, it can be quite risky. So how can technology help? In fact, many people have invested in a blood pressure monitoring machine during COVID. So how can people really benefit from monitoring their blood pressure at home?
Sure. This is a very, very good question. And if I talk of health vitals or parameters, if you're missing something, and especially as critical as blood pressure, it can have a very major impact. And what I want to say here is that, pandemic has taught us to use a lot of devices, a lot of products at home. We have started using pulse oximeter to see the oxygen saturation. We have been using the thermometers, and very widely for a long time we have been using a blood pressure unit also. So let me just first explain what does it do. So in blood pressure, it measures two parameters. One is, if you generally read, it is like 120 by 80. What does that 120 say? 120 is a systolic blood pressure. This is at the time of beating heart. When heart is beating and contracting, that parameter is this. And when heart is relaxing, that time that 80 comes, or whatever number it is. Now, high blood pressure is really a very complex situation, because high blood pressure can lead to a heart attack. It can lead to many other challenges. It can start damaging your kidney blood vessels, and finally, it can impact kidney to a greater extent. Even on a brain stroke, it has a very important role. So I feel that since there is a direct correlation, we should be very careful of it. And we must continuously keep recording time to time based on the family history, based on doctor's recommendation, and undoubtedly these instruments at home will add a lot of value. How I see going forward with the aging population, we will see more and more such devices uses at home, and more connected devices. And when I say connected devices, devices like weighing machine, pulse oximeter, BP, such instruments can be connected to each other through app. And your data can be stored on your mobile for a long time, and you can refer that, and your doctor can see the trending. So, these devices at home are going to do a lot of great work in time to come, and I feel that home care products and home care solutions are going to become a very vital, and BP is a very critical device in that.
Dr. Seth, deaths because of heart disease is increasing. We've been seeing that over the last few years. How can we really reduce this burden?
So we've got to understand that our lifestyles have changed tremendously over the last 10 to 15 years. Deaths from heart disease have increased by 300% over the last 20 years. In young people, it's increased by 200%. We actually have India's become the world capital of heart attacks, which is sad. We really need to modify our lifestyles, and we need to relieve stress. So there was some very good things said just now. If I was to tell you that our lifestyle, especially in the last 15 years, have become fairly artificial in terms of the fact that we are in a permanently stress situation. It's a very competitive world, especially for the young gen. There are timelines, there's deadlines to be met. Eating at home has become a rarity. It's usually catch a meal outside. Exercise has become rare. Gymming is not necessarily the right exercise. There are ways to exercise, heart-healthy exercises. For example, if I was to tell you that 45 minutes of brisk walking 5 times a week can decrease our chances of having a heart attack by 20%. That is huge amount that we can actually decrease.
Yes,
by the way,
absolutely.
stress. And can I just dwell on the stress a bit? Our youth, our young people are more stressed at this time than anybody else. And one may argue that, of course, everyone's stressed. You have stress. I have stress. Everybody in every profession has stress. But it is how you can handle that stress has become the most important aspect. And yoga is one of the finest ways to address stress, to relieve stress, but there's also spending more time to yourself, taking up hobbies, having pets, going out. And by the way, all
Actually
that has
making
disappeared
time
from
for
our
each
lives.
one. Yeah, I think
And that's disappeared from our lives, especially for the youth in the last 10 to 15 years.
Absolutely. I think taking time for ourselves, really enjoying what we do. Luke, like even Dr. Seth was telling us, it's important to really take out time for ourselves. Can you give us, our viewers, some tips that how we can really, de-stress ourselves? Like even if you really look at it even now because of COVID, there's been social isolation, work from home, boredom has set in, mental well-being is another huge issue. So how can we really tackle this?
So I think there's one very simple way. It's the way we change our outlook. Everyone sees stress as something negative. Stress is never a person, a thing, or an event. It's the way you relate to a person, a thing, or an event. So I think people have to start changing, like Dr. rightly said, changing the way we relate to something, to start understanding that being in a rat race only keeps you a rat. Be in it, but be a healthy rat. Take care of your lifestyle, the way you eat, sleep, move, think. All of these things have to come together with it because the statistics are real, disgraceful, in fact, for our country, considering we have medicine, nutrition, yoga, culture, everything together. What lacks at a human level is discipline and consistency and the want to actually respect the human body. So that requires self-work at every level.
Ira, yoga we've understood is really important. You know, it improves the heart health by increasing circulation, blood flow. What do you think? How soon can one actually start practicing yoga or any other form of exercise post-COVID?
I actually recommend to people, do yoga in a very mindful way. Don't, listen to rock music and do yoga at the same time, because then you're not really focusing. Try to focus and let your body speak to yourself, and your body will tell you, because everyone has a different capacity post-COVID. Yes. I urge everyone to not do a lot of aggressive exercise, no matter how fit you are right after COVID. For at least 3 months, tone it down. Even if you really want to get back, and I see this with students, they say, we want to get back to our previous practice. We want to get back to our runs. We want to get back to our gym. We want to feel back to normal. I tell them, listen, don't do that. Listen to your body, and if you feel like you need rest, this is not about competing with your body. This is about cooperating with your body.
It's about understanding that signal, I think, when we know our body is the best.
And cooperations. We don't have to ever fight with our bodies. This is us. It's all one being. But we fight, we struggle, knowing that this all belongs to us. Our organs belong to us, our body belongs to us, and our mind belongs to us. And we're meant to cooperate. We're not meant to compete, So, and your body will always tell you. And if you pay attention, and I see this because practitioners of yoga gain that mindfulness, they begin paying attention. They don't even eat incorrectly anymore because their body tells them when they need sugar, they will take in sugar. When they don't eat sugar, they won't even crave sugar anymore. So naturally, by this practice, you can become more mindful, and it's just by investing a little bit of time of going within versus going outside.
Yes.
Because the world is constantly compelling us in an outward direction, when the reality is that within us is really a wealth of information and knowledge that we can tap into if we pay attention.
So it's just about tapping that. On that note, we're going to take a short break. We'll be right back.
Presented by Bajaj Allianz, caringly yours. Co-powered by BPL Medical Technologies.
हेल्थ के मामले हो छोटे या बड़े, हमेशा साथ हम खड़े। हम हैं caringly yours, caringly yours।
बजाज अलियांज जनरल इंश्योरेंस में हम आपकी रोज की छोटी बड़ी चिंता का सलूशन देते हैं।
caringly yours।
It is BPL who started ECG machine manufacturing about 55 years back. I mean, today we are talking of Make in India, but it started long back. And over a period of time, we also built the complete range around it. Whether it's the defibrillator range, whether it's the treadmill, which is a stress test system, eco machines, patient monitoring, your Holter, so every complete solution we did. So our contribution toward the cardiology sector has been absolutely very significant.
Welcome back. We're talking about how important a healthy lifestyle is for a healthy heart and how simple changes in our diet and lifestyle can make a difference. Mr. Tapan, most people feel that one should not invest too early in life and health policies. What is your advice to people now, especially in the post-COVID era? In fact, even when it comes to the heart, we see that younger people are getting affected.
It is not about just buying insurance as a transaction, that I'm buying insurance so that I get money back. That is not how it is. And at an older age, I'll be having a more risk compared to younger age. No, I think insurance should be seen in a different perspective. There are 2-3 perspectives I'd like to bring forward here. The first perspective is most of us are saving money for the rainy day. That is what I remember in my 20s when I started working. My mother was saying, save money for the rainy day. If things go wrong, you should have enough money. So in a way, we are freezing our earning, which can actually freed up for the little joys that we want to have. Maybe travel somewhere, look at the world, or buy something that we want. And it's simply done by taking a bit of the money, buying insurance, that if something goes wrong, I'm adequately covered. So I don't have to run pillar and post to figure out from where do I get money for my treatment, So it doesn't matter at what age it is. The second point it is that God forbid something goes wrong. Let's say, from my perspective, I would say I'm overinsured. The issue is that I don't want that the money should come to me. I should be perfectly healthy, nothing should go wrong. But unfortunately, somebody somewhere is falling ill, somebody somewhere is going through a misfortune. My money, which I paid as insurance premium, is actually being utilized for helping somebody else out,
Mr. Tapan, you rightly said it's a noble cause, and at a point where somebody's stressed, you don't want to be running from pillar to post to arrange money. Even if you're talking about heart, experts have been saying, whether it's yoga, we need to change our lifestyle. Some way, in case one needs treatment for a heart disease, that is also very expensive. So it can make a huge impact on someone's socioeconomic status. So what are your thoughts on that?
See, heart ailments, or if you look at the ailments that we are now facing today and at a younger age, it is most to do with stress and lifestyle management. I think it's very, very critical. And stress build-up, I have personally seen, when I started working 30 years back to the work pressure and the way things have moved over time, I think it's a very, very different world altogether. I think connectivity, being on the go, 24/7 connected, is beautiful. But at the same time, it also can lead to huge amount of stress. We do not know how to manage it. Now, can you be out of it? The answer is no. But the answer is that how do you are able to manage all this in a very, very calm, peaceful manner, and how do you look at your life very holistically? So I think, as I said, one, insurance there, and now insurance companies also bringing in wellness along with insurance product that they have. Fundamentally, they realize that wellness is being a very, very critical aspect of taking care of our customers and ensuring that we are being with them. So that part has been taken care of. But from an individual perspective, I think even if you're feeling very fit, very healthy, and very good, it's time to start looking at wellness very, very seriously.
Mr. Khurana, how has BPL Medical been contributing to the cardiology sector since its inception? And today on World Heart Day, would you like to convey any message to the viewers right here?
At this junction, I want to just thank to all the cardiologists, all the clinicians, experts engaged, saving life. It's a big deal, and they have really been working so very hard during the pandemic time, before that, and now also. And to the viewers, my strong recommendation is that you should, to keep your heart healthy, you must consult time to time clinicians, follow their instructions, go on a regular exercise, and also a right diet makes it completely good. So this is what I want to say, and I wish you all to stay very healthy and with a great heart.
Yeah, I think that's a very important point, not to ignore any signs and take care of our body. In fact, cardiovascular diseases risk prevention is one of the important priorities among India's sustainable development goals. While we know that a sedentary lifestyle, bad diet and unhealthy habits have made us susceptible to various cardiovascular diseases, but it is really up to us to choose the kind of lifestyle choices. Intelligent eating, habits, healthy lifestyle, workout routines, and most importantly, managing stress levels. Thank you so much for joining us today.
Thank you very much.